Welcome to the End the Silence podcast. I'm your host, Sandra Payne. As an RN and holistic wellness coach working with nurses, I am uniquely positioned to hear the struggles, the deep passions, and the stories of nurses, our silent heroes. Many nurses suffer with burnout, depression, anxiety, PTSD, substance abuse, and suicidality, and they do so in silence. Nurses are the ones we turn to for help when we need it the most, and this is a heavy burden for them to carry. This burden, the pervasive bullying and unsupportive culture of our healthcare system, means many nurses have lost their voice. These are their stories. My guest today is Piroska Bata. Piroska is a nursing professional with 31 years of burn, trauma, critical care, and mental health experience in a variety of roles, primarily including teaching and business management. She studied nursing at McMaster University, as well as professional coaching, and also completed her MBA in Toronto. She is currently studying for her Master in Arts in Counseling Psychology at the Yorkville University. In addition to her studies, she has earned her licensed Master Practitioner certificate in Neuro-Linguistic Programming and became an NSP hypnotist. On top of that, she is now a licensed trainer of NLP, a Reiki Master Teacher, and a Therapeutic Touch Practitioner. Alongside her 31 years of nursing, Piroska is also co-chaired for the Brain Injury Association of Canada and has been a passionate speaker about brain injury, mental health, and workplace violence prevention, and is a strong advocate for RNs to work within their full scope of practice and supporting nurses who have experienced trauma in their nursing careers. Dedicated to excellence in patient-centered care, evidence-based practice, best practice guidelines, and working collaboratively to create models for outstanding customer service with integrity, humanity, respect, and dignity. Her mission is to ensure that nurses can and do work in all areas of healthcare, are at the decision-making table, and influence with their holistic view of human health and wellness and the future direction of our Canadian healthcare system. I am so honored to have Piroska here with us today. Welcome to the show.
So thank you very much for having me. I'm very excited to be talking to you in person.
Yeah, it's so great. This is just such a wonderful opportunity, to meet people in a sort of a whole new way, but it is what we got and we got to take it and run with it these days. I'm sure, just getting started, it's really always best to kind of dive right in and hear a little bit of your story. So I would love for you to share with us, just a little bit about who you are and your journey as a nurse thus far.
Okay, so I've been nursing for 31 years. I do believe I'm unique in the sense that I've done so much in nursing. I never dreamed of doing all the things that I have done. I started out in medicine. I graduated from McMaster and I started out in just a medical unit, which was actually one of the best things I could have done. And I would recommend that highly for all nurses who start out to go on a basic medical surgical unit to work because it really allowed me to become organized. And I had a really great team. I had a great nurse manager. So it really set me up for success for the rest of my nursing career. After that, I went into burns and trauma and then into ICU, neurotrauma, CVICU first, and then neurotrauma and med-surg ICU. And I worked here in Ontario at the 3 big trauma centers in the Golden Horseshoe, which is Hamilton, and then 2 of them in Toronto. Now, the ones in Toronto I did as an agency nurse. While I was doing that, I also became a black belt and I taught self-defense. And I also became a Reiki master, a Reiki teacher. I did therapeutic touch, as well as eventually became a hypnotherapist. And after I stopped doing bedside nursing, and while I was in bedside nursing as well, I was a clinical educator. So I worked for a number of universities and colleges, as well as later on had an academic appointment where I taught mainly cardiac for international nurses. And the other place that I really enjoyed working was teaching RPNs to become RNs in the clinical setting. So I did a lot of different things. And I also did some consulting, became an NLP licensed practitioner and also a master practitioner, and then started teaching. So everything kind of ended up in teaching somehow, passing on information. But I don't think it was just teaching nursing per se, but also how to be in today's world. And there's been so much changes happening. So that's sort of in a nutshell, sort of all the different things I've done. But everything I have done was with one purpose. How can I become a better nurse at what I do? How can I be better in doing what I'm doing?
I love that. It's, just this continual seeking of knowledge and growth. And that's the kind of inspiration that we need as teachers as well. Listening to your brief little synopsis, there's such a wealth of experiences that you've gone through, definitely on the outskirts of what we would see, our Western traditional medical system with the martial arts and the Reiki and the therapeutic touch. Can you share with us a little bit more about how those practices complemented your nursing practice and maybe even also how you use them outside of nursing?
So therapeutic touch, I was introduced to by one of my professors at McMaster. semester when I was in third year university, and then in fourth year. So she did a sort of a level one with us because I was the education coordinator for our nursing society. And that really piqued my attention. I was like, wow, this is kind of interesting. I never thought of this. So when I graduated, I eventually took some courses at Sheridan College, and then at Hamilton Health, at the time, Hamilton Civic Hospitals, they actually, the professional practice director, I believe, brought in someone, and we were teaching it to nurses. So I was doing it in the hospital to burn patients, trauma patients, to help with pain and healing. And people were requesting it. And same thing happened with Reiki. So I was able to do it fully as an RN in ICU. And the beauty of it was that once people noticed that I was actually helping, they would say to me, Piroska, can you come and check this out here? Like, can you help me here? Because this patient, I'm not sure what to do. And so it was with the hands-on practice that I actually sort of got them to accept it because they noticed there was a change. And that's what we're looking for. The good thing about it for me was that I was able to help people. I mean, that's the bottom line. When someone was suffering and there was nothing more we could do, there was something else I had in my back pocket that I could help. And so that gave me a lot of satisfaction that I'm able to help in some small way. The martial arts aspect, which has become more important lately, not because I'm practicing, because I haven't done anything because everything's locked down, but it was more about recognizing how to handle violence and how to handle conflict. Part of that also is NLP, neuro-linguistic programming, because I had my own company teaching how to manage fear and how to do self-defense. And one of the things I noticed in nursing, that there was a lot of violence in nursing, especially when I got into management. I did 3 years as a manager. Later on, even as an educator, I noticed that even in education, my students were afraid to go into certain rooms or they didn't know how to handle things. And what that did was I realized nurses need to be taught how to manage violence, how to manage and predict, like recognize there's something going to happen and you have short period of time to figure out what to do. What would you do? How can you verbally do something? How can you preempt, like meaning you can see something's going to happen. What can you do ahead of time to predict it and maybe get security? And also what would you do physically and verbally? What I did was, which I didn't sort of mention as part of my intro, is that I'm also very active in the Registered Nurses Association of Ontario. And I put forth a resolution that nurses should be taught in basic nursing education how to recognize violence, know that it exists, how to verbally deal with it, what other things can we do to predict it. For example, did they have a change in medications? Sometimes just that much, especially in elderly, can create confusion and then paranoia and then maybe even, lashing out. Or how can we look at certain policies? What can we do? Because violence is not just about me protecting myself or keeping the patient safe. It's also about protecting other patients, family members, and other staff. And so a lot of people had to kind of wrap their head around that we're doing more than just one patient. It's actually a collective that we're taking care of and keeping safe. And we're supposed to protect the public. And so it's just like infection, you're going to do certain infection control practices. Well, the same thing with abuse, because sometimes a verbal altercation can turn into a physical altercation, but how do we know that it might? And so I worked hard on that, and it was voted in by the RNAO that yes, they will be working on that piece, and they are. So that helped me further nursing practice in a way that, I never would have imagined.
That's so powerful. Yeah.
Yeah. And the other thing that it helped me do is I was on committees for example, for hostage taking, for bomb threats, so that when we were writing policies in the hospital, I was able to be part of that team in a way that I never would have thought possible. The other thing it helped me do, this is with NLP, neuro-linguistic programming, is how do I talk to my patients? How do I teach them? What kind of words can I use so that I impart information in an accurate way? However, it is the most useful way for that client. So one example is sometimes when someone is prepped for surgery or comes back for surgery, some people may say, oh yeah, we're going to give you drugs, but you're still going to feel pain, or pain medication won't take everything away, so don't think it's going to work or whatever. So everybody has different ways of explaining things. But I always tell my students, imagine if you say to them, you will have pain medication. It works. It may not take it all away, but we have many ways that we can help you. And then you can breathe better. You can use all your exercises and you will get home faster. If you compare those two ways of talking to a patient, which one will do better? So we have power with words, how we educate. And so NLP has really helped me to educate not only the patients, but also my students.
with your wealth of knowledge and these incredibly lucky students to have you as their teacher, and you were saying how the Registered Nurses Association of Ontario has adopted these practices. Tell me, how have you seen it being implemented?
It's going to take some time. So what they're doing is they're lobbying with other organizations to recommend, and then we have to lobby. So it takes sometimes years for things to actually come through. So slowly it's being adopted. I know that the CNO here, the College of Nurses of Ontario, a few years ago started talking about creating something with each college university that they had to implement some sort of education for those who are going to clinical practice. So that's a first step. And I think they recognized that they had to do something, that they had to have some kind of knowledge. But I think with this resolution, there's going to be a much more broader creation of some programs. Now it's out of my hands at this point. So it's in the hands of the RNAO and then those who recommend program development. But I'm keeping a close eye on it to see how it all pans out. But the fact that it's there and there's an awareness, I think no matter what I look at in nursing or any other discipline, is that once we become aware of a problem and we start working towards a solution, a lot of other information comes in. The other beautiful thing is that the RNAO does have a best practice guideline when it comes to this, and it's a very good one. So if they completely apply that best practice guideline, that's all we need. Truly, if they just teach that best practice guideline and implement all aspects of it, that will be brilliant.
So good. As you're talking, I was reminded of a program out of UBC in Vancouver, and they are working with nursing students regarding the bullying that happens in nursing. So not necessarily the physical violence and not with patients, but more of the nurse to nurse or nurse to other healthcare provider, lateral violence, if you will. Their program is, they use role play and education as well around the reality of bullying and this kind of risk of violence in the profession, which, when I think back to my training as a nurse, I don't recall even a conversation around this. Mm-hmm. And so I think it's really amazing that there is a movement towards making this more of a priority to teach students, and staff, let's face it, but to start with students, because as they come into those environments, to be prepared for the realities mm-hmm. of this profession. So tell me, now that you have all this, you've taken all these trainings and you have all these really incredible resources available to you, and you've been imparting your knowledge and helping to create change. If you could think back, throughout your career, what were some of the biggest struggles that you faced as a nurse?
Actually, funny enough, when I first graduated back in the 1980s and 1990s, there were two different streams of how nurses could enter the nursing practice in Ontario. One was through the college system and one was through university. Back then, the university programs were honor degree programs. So you had to maintain, I think, 75 or 70 and above 70 or 75 average to stay in the program. And at McMaster, we actually did a nurse practitioner certificate program within the course. We never got the certificate for it, but we had to do it. So that was a really good program. But here was the issue. We didn't graduate a lot of BSCN grads back then. So we were actually quite a rare item. So I was the very first nurse working on the medical floor where they hired me that had actually had a degree. And one nurse came up to me and said, "I don't like degree nurses," at lunchtime, sat down and just said it straight to my face. And I just said, okay. I didn't know what to say. I was like, okay, whatever. Mm-hmm.
Yeah.
Basically, I just kept working and I just didn't let her. She tried to intimidate me. And I was like, okay, that's kind of weird that you can actually try to intimidate me at lunch. But you know what? The team I was on, they were wonderful. And I remember once there was an incident on the floor and somebody had a seizure in the bathtub and I dealt with it. And I didn't know that it was a big deal for them. And I get called to the nurse manager's office. And I thought, oh my God, what did I do wrong? And as I go in, she goes, actually, your team said that you handled that situation really well. And they told me what a great job you did. And I was like, oh my God. From then on, I realized that they had my back, my team. And actually they taught me, but they said to me, you're safe. You always ask good questions. We trust you that you will never do something that will harm a client. Imagine when you develop that kind of trust. So I had some people who bullied me right off, literally day one in, and they're like, I hate you because you have a degree, mm-hmm. to, the team recognizing that I actually really am fully there, present, and doing a good job. And so that really set me up for success. I never really paid attention to a lot of these struggles, but they did happen. And one of the biggest problems in nursing, and I think this is a struggle, is that people forget that when they graduated, they didn't know everything. And when you go to work as an RN, everybody thinks you should know everything, just like what they know 20 years later. Well, that's not possible. So I always tell students, ask questions and don't worry about it. Just ask a good question and ask them for help. I know how to do this, but I've never done it. Can you come to supervise me? Can you make sure I'm safe? That's it. I've noticed a lot of young nurses are afraid to ask questions because some of the more senior nurses think, oh, you should know this by now. Well, no, not everybody knows everything. And especially when someone's nervous, they tend to forget things or they forget pieces of information. So if anything, we need to be kinder to each other and remember that through fear, people will actually be in a stress response and will remember less than if they are taught through kindness. And let me show you, they will remember better. And that's a very simple concept, but somehow nurses don't know. And so I've had in each unit I was on because I'm a very nice person and I don't usually make a big fuss of things. They really think that you're not good because you don't talk a lot or you don't talk a certain way or whatever. So many times it happened. And I just look back at it going, oh, that was a good learning experience. I know how to handle stress, that's for sure. And it traumatized me at the time, but I kind of let it go. And I think one of the good things is that they were always there who supported me, who said, no, Piroska, you're smart. You know what you're doing. Don't let those people get to you. And then that kind of helped me move forward. So I think if we see someone being bullied, somebody needs to step in and say, hey, you know what? That wasn't right. Or don't let them get to you. Or they mean well, but they just don't know how to show it or whatever that may be. Now, I do know that there's tremendous amount of research on horizontal bullying, and it's something that definitely needs to be looked at, but it is a culture. I have no idea how that culture came to be or why it happened. I don't understand it personally. Sometimes I was bullied to bully people. It was really bizarre. If we recognize it and become aware of it, not just the nursing students, but those who are already in senior positions, how can you impart knowledge and skill and judgment to a younger nurse? How do you do that? I think that's really important. There's one caveat here, and I've noticed this, there's a cultural difference, especially when international nurses come. How they're taught in different countries is very different, and their perspective is different, and their hierarchical structure is different. So in some countries, they believe you should know everything, and if you have to ask a question, that's a bad thing. So we need to nip that in the bud, because they're not bad people. They were just taught a certain hierarchical way of dealing with situations. And I've had that with some of my charge nurses, and I had to tell them, it's okay to ask me a question. Please don't pretend you know everything because we're a team. And I think that's what's really important is how do you create a team environment in nursing versus a sort of, no, I'm above you and you're below me. One of the places that I learned that really well was in ICU. I found when you find the right team, not just nurses, but physicians and physiotherapists and pharmacists and environmental aides or janitors, whatever you want to call people, they have different titles. When we worked as a team, it worked amazingly well. And when you have a really well-oiled team and respect for each other, then it works really well. One other thing I'm going to say is, and this is something I've noticed as well in healthcare in general, people really do not value sometimes janitors or people who are cleaning, environmental aides or porters or so on. I can't tell you how many times, I think she has passed away, she said, Piroska, you always say thank you. And I thought, wow, they actually value that I say thank you. How many people don't say thank you or ask nicely? Simple things like that really surprised me that people would say to me. Even one of my staff said to me, she says, you know, I'll do anything for you because you always say please. You always ask nicely. So then what does that say of the rest of the nurses, whether they are float managers or whether they are managers or directors, whatever? What does that say about the culture of hospitals that people are not asking nicely, that people don't say thank you? And I think if we bring that back, because it's by example. I am the example to my nursing students. I am the example, even as a parent, to someone. So if I'm rude, what am I teaching someone else that this is acceptable? No, it's not. And so I think that's the lesson that I learned, that first of all, I don't want to be like that. Number two, I'm going to be the example and I'm going to treat people with respect, and everyone. Here's the beauty of treating with people with respect. When I needed a project done as a manager, everyone was like on board with me, doing things, will help you. I got things done faster than anybody else because I respected them and I personally knew who they were, knew their name, and even visited them in their offices or in their place. They were surprised to see me because I cared about getting to know people and building those relationships. And once you build those relationships, they're so invaluable in no matter where you work, in what environment.
I think this is just brilliant. What I'm reminded of is, these talks I've given before where I've talked about the nursing idol and how, we have new nurses coming in and new nurses on the floor, what, sometimes people call baby nurses. And they're looking to more experienced, more senior nurses as, what do I need to become as an idol, right? And we have this culture that is fear-based. And it has lost so much of the humanness that needs to be there, right? Like this idea of treating people with kindness and compassion and understanding, to be supportive and value other people and to just really see each other on the same level instead of this hierarchical system.
Absolutely.
Of like, I'm a nurse, you're a healthcare aide, I'm better than you, I get to talk to you in this way, you get the junk jobs and I get the glory. That competition and that division is so toxic in healthcare. Yeah. So I just really appreciate you bringing that forward and talking about this. And, even just hearing your story about when your manager asked you to come into her office, how you were right away, like, what did I do wrong?
Exactly.
And, the students who are afraid to ask questions because they don't want to seem weak. They don't want to seem like they're not smart, like they're not going to be cut out for this job. And I think, of the work that I am doing and just, the amount of nurses that I talk to about these struggles and these challenges is like, we need to change the idol and that is in nursing. And it really comes down to the entire culture, which has to come down to each individual because we can't change everybody. We can only change ourselves, right? But the more of us who listen to, who listen to interviews like this, who talk to other nurses and hear other people's stories and hear, the pain and the fear that's going on, I believe, it sparks things inside of us as human beings. I really, truly believe we don't want to hurt others, but we're just, sometimes when we're hurting ourselves, it's easier and we fall into these patterns and we see this culture in nursing where it's just, that's the way it is. So, if you can't beat them, you might as well join them kind of deal.
Yeah. And it's very toxic. That is terrible.
Yeah. So thank you for bringing that all to the table here. You shared a little bit about the policies and that you had teaching students about the violence and that was going on with the RNAO. Tell me though, what has been maybe one of your biggest successes as a nurse? Like what has kept you coming back? It's a hard job. It's a hard job and it takes a lot from us.
You know what? It's the little things. I call them warm fuzzies. It's not the big, like people get awards. I have no award. I have nothing. I'm not even recognized in anything. And I've never been like nominated for anything or whatever. But you know what the best reward is? When a patient thanks you and like really says, thank you, like you really helped me or appreciated me, or you get a beautiful thank you card. And we all get them, but we don't get them all the time. So when you do, you really felt it's heartfelt. I remember this one patient, oh God bless her soul, that family, it was a horrible situation. And she was a quad. She was in a bad car accident. She was 17, I think. I remember that Christmas, I worked something stupid, like, I don't know how many 12-hour shifts in a row, how many nights and days. And on my last shift on that unit, they changed me to another room. I mean, people, especially in ICU, they know what that feels like. You're just like, really? Yeah. Like, come on. I was just not happy at all. And someone said, no, they requested you. Someone wanted you in this room. There's a reason why. Just go check it out. And it's Christmas Day. And I was like, oh my God. And I was like really not happy. And I'm usually not very verbal about it, but I was quite verbal. And I get there and I find out that they wanted me to be with this young lady. And it was even worse that her brother died 2 years before. And the person that hit the brother had the same last name as the person who hit her. I can't even imagine. And so this is Christmas Day and she is scared out of her mind. She's on a ventilator. I mean, I felt for the family. It was horrible. I kind of the plan was for me to make a good day for her. And I got report. And I always try to humanize things because people forget to be human in any situation, because they're always so worried about what's going on that they forget that there's all aspects of being human. It can be humor, it can be kindness, it can be laughter, it can be, pain, expression of emotion, talking about stuff that, like, hey, do you want to put makeup on today? That kind of stuff, especially for girls. You want to get your hair done, whatever. we can do anything. I mean, ICU is magical. We can make you look good even when, you're at your worst. Like we try to make it, humanize it. And so I get a report and they're telling me that she is on a ventilator and obviously very scared because when someone's a quadriplegic, well, she was a quad at that point, but a lot of times when it's a fresh injury, we don't know what's going to happen. It takes a bit of time. And the more things come back, the sooner, the more likely that there'll be a lot more improvements, especially when they're younger. So she had a lot of hope in some ways, but she was basically had a tracheostomy. So she was not going to be talking. She wasn't breathing on her own. So there was a lot of issues. Anyway, I get a report and I go and introduce myself to her. And I can see that she's like, oh my God, I got a new person. So this is like a whole other ball of wax. And I explained to her what I'm going to do, so on and so forth. And I'm going to assess you. And this is what you're going to feel. This is how the day's going to go. So I lay it out for her so that she knows where I stand. As we're talking, she's very serious. And then I said to her, but you know what? I'm going to tell you a secret. I said, I'm a very serious nurse, but underneath, I'm just like a little kid. And she kind of looks at me like, what the heck? And I go, that was a joke. It's okay to laugh. She looks at me. She kind of cracks a smile. So I got her to humanize, to kind of say, hey, you're in a bad situation, but it's okay to smile. And I gave her permission. And that's how our day went. And I had her quite a few times. What happened was she got better. She ended up sitting up. And I remember going into another unit and they said, hey, Piroska, come on here. So-and-so's up in her chair. Come take a look at her. And when she saw me, she was able to move her arms and she was waving like crazy. And I'm like, oh my God, look at you. Like you're sitting up. How great. And someone was trying to explain stuff to me. And I'm like, no. I said, she knows me. I'm a big kid. I'm a little 5-year-old girl. And the smile on her face was she was beaming because she knew who I was. I feel like crying actually because it's very touching. And I got her to laugh and smile, which is really hard to do. And that I consider success because it's a one little thing, but it made the world of difference to her that day. And I think if we do that as nurses, that's far more powerful than any degree, any honorable mention, any certificate you can possibly get or someone tell you, wow, you're amazing. It's that moment that you make that difference in that person's life. And so to me, that was an example of a warm fuzzy. That's what I would call it. The other situations that I find that I think I've been successful, and this is very morbid sounding, but when people were passing away with dignity. And I was really passionate about, especially in ICU, that people pass away with dignity and being able to practice their spirituality or religious practices, and that the family was able to be there and do all the things that makes them a family. I remember a number of cases where they thanked me that I was present, that I was able to help them through this. And I remember one particular family, I got to know their mother through a letter that they wrote when they had decided that they were going to let her go. And they taught me, because I had her quite a few times in a row, so it was that decisions were being made while I was there and through conversations with the ethics board and the physicians and so on. And I remember they gave me a present, and it was a little angel and a little fairy from her home. And I still have that angel. And they said that they showed me who she was. She was always full of life. She came into the hospital in respiratory distress with sparkles in her hair. She was 87. And they said she would never say no to a coffee date. She always wore high heels because she was short, but she was always just, when you look at the pictures, she was just like smiling and like, ta-da, I'm here. And every time I look at that angel, I think of her, because when life gets you down, I look at that angel and I think, wow, she was full of life. So don't forget being full of life, because that's what life is about. And so these are the things that I think were really special, because I get to know human beings on their human level and allow them to be who they are. Even though it was a difficult time, I allowed them to fully experience that in a dignified and respectful way. So if any of the things that I would be successful of is that, not to mention my students, because a lot of my students are now, some of them are physicians and nurse practitioners and work in ICUs and ERs, and they're educators and they're doing wonderfully well. And I'm very proud of them. And I'm proud of them, not of me, but of them. And I always say that as a teacher, what we should aspire to is that our students do greater things than we did, that they go further. And I tell them, go conquer the world, go further, go that extra step, so that we ripple it into the future, meaning whatever I teach them, that true compassion, that kindness, remembering why we started this journey, that then they ripple that into the future, into the students, their patients, their families, whatever that may be, so that it ripples, so that we can influence the world that way. Because it really starts with us. But if we can give that gift, then that warm, fuzzy feeling, and it's not a feeling, but it's really being that kind person. There's no word for that. You can't measure it, but it's there. So I think that's how I see success.
I'm kind of speechless. As you were sharing those stories, I definitely was, tearing and just right in there with you. And I just, I feel so honored to have heard such a beautiful story. And it just reinforces to me as well, because so many nurses say the same thing, that it's not about those big things. It's not about Nurses Week. It's about knowing that you're making a difference in someone's life and having the opportunity to connect with people in some of their scariest times on a human level. That true, authentic connection of one soul with another is something so powerful. You're right, it transcends anything else we can do. That connection, that human connection is just, it's so beautiful and so critical to everything that we're doing. Every time someone shares stories, I have floods in my mind of memories of patients I've cared for and their families, and the ways that they have connected with me and brought that same level, because we experienced it too, right? You gave to those people, but we received something too. And so it's just such a highlight of the beautiful opportunity that is given to us as nurses, that we can so easily forget, because we get sort of bogged down with all of the policies and the charting and the overwhelm and all of that, right? That we forget this gift that is being able to connect with these people. I've heard so many people tell me too about this at the end of life, and, working in that time with people. And we preface it with like, this might be morbid, because for so many people, talking about death is like, it's just not okay. But when you have the opportunity, and I worked in palliative care just at the very beginning of my career, and I get it. We had this 50-year-old man who had ALS, and he couldn't move, he couldn't talk. And we would prop him up in the tub with a beer in his hand and his cowboy hat, and like play tunes. And it warms my heart still to this day to remember those times. So this is really the power of our stories. So I just appreciate you sharing that.
Thank you. You know what, as you're talking, sorry, something came to my mind as you're talking, because I'm listening to you and I'm thinking, one of the things I always say to nurses and to anyone, that we are it is a very honorable profession and calling, because we truly take care of people from birth to death and beyond. Before they're even conceived, we're taking care of people so that they can conceive and healthy. And then when they're born, and then everything in between and after. So in their pain and their suffering and in their joy, we share that such closeness, and people honor us with their trust that we're going to help them and be there in those moments. So I think if nurses think of it that way, that they honor that sacred space that we're given, because we are in a sacred space. Oh gosh, I'm almost teary-eyed, because that's very sacred and very trusting. And people forget sometimes, like lay people or even physicians or people, that sacred space we have at 2:00 in the morning with a patient who's suffering, and we alleviate, or they allow us and they express it to us, even if they're angry, but they're expressing their frustration. It is a sacred space. So we need to honor that. And if we can somehow impart that to nurses nowadays, because they do get lost in charting and computer. I think that a lot of this digitalization of data and this computer stuff takes away from the bedside, in a sense of sometimes we just need to hold their hand and just listen. That's it. And honor that space quietly.
I couldn't agree with you more. I have so enjoyed this whole conversation and hearing everything from you, your story, and just these intimate details of some of your experiences. And I'm sure there's, hundreds more. I just would like to give you a chance, just if there was anything else that you felt like you'd like to share with those that are listening.
I mean, from the top of my head, I think one of the things that I'm concerned about, and I think maybe this is a concern now as I move forward and see where nursing is. Right now, nursing is scared and maybe angry and frustrated that we are supposed to advocate. We are supposed to be there for our clients. And the climate has changed so much that, number one, with respect to pay and working the way we were taught to work, we're unable to do those anymore. There were certain freedoms that we were able to work with that seems to be more and more veiled in policy and procedure. I used to joke, but it's not a joke, actually. I'm very serious about this. If somebody has money to fund me, I would build a nurses' hospital and run by nurses. And this sounds very crazy, but what I'm noticing is that when I work with nurses, and this is going to be a story that kind of reminds me of what we did on a committee. Many, many years ago, before they decided to put everything onto computers, we were harmonizing charts for ICUs in a particular organization. And they invited people from ICU, all the nurses, a bunch of nurses, and I was on that team. And then there were other like respiratory therapists and physiotherapists, whoever was part of the charting, they were invited, they were part of that team. And we had a facilitator, and she was lovely, but she was not a nurse. She never worked in ICU. She had no clue what we were doing. And she was trying to follow a process, but it was taking a bit long. And I think one of the things is that we have a really good process-minded, practical way of applying our knowledge and getting things done. And sometimes that's a good thing. Not always, but sometimes that's a really good thing. And I think we're also efficient. And one of the reasons we're efficient, fast, and also very process-minded, but in a simple, basic, logical way, is because we know that life and death depends on it. If we can get done first thing, everything in the morning, we would, because we know that if something happens later on, at least this is done, so I can manage an emergency. And I think there's a lot of good skills that we develop as nurses to predict things or figure things out, and even just using our intuition. We teach this in clinical and even in class that, sometimes you have this feeling about something, listen to it, because something tells you that you can't really put your hand on it, that something's not right with this patient. And most of the time, we're spot on. And so I think allowing nurses to be much more present in planning and in doing things is so important. And right now, what I see is that nurses are losing the footing. They're losing the footing in having their voice heard. They're losing the footing in organizations take over what we think is part of our process. And also being paid, like in Ontario, I know there's a lot of stuff going on with some legislation. And I'm not going to get into that one way or the other, what's right or wrong. But I think valuing nurses' contribution when it comes to how educated we are, and especially here in Canada. I mean, Canada has some of the most educated nurses in the world. Everybody has to have a degree. And even after that, some of the clinical placements and some of the clinical practices, how much certification nurses have to have even after graduation, it's pretty much insane. And same in the United States. Like, it's just, you really are expected to have a very high level of education and knowledge and experience. It's not utilized to its maximum. It's actually really dumbed down, what I'm seeing. And it's not everywhere and it's not in every case, but there are places where nurses could be really utilized to be much more innovative, much more effective. And one place is, and this is not close to my heart, and I think this is why I'm still in nursing, is independent practice. Nurses are quite innovative. I mean, I've done stuff in ICU, like I rig things up, tape things up. I think I won like MacGyver awards because you just had to make it work and you figured it out. And you can use things more than one way. And so we become engineers, we become, I don't know, plumbers, we become everything, washing the floor, whatever we have to do, we get it done so the patient can be taken care of. Following all the policies, safety, infection control, and so on. If nurses were allowed to really dig deeper into those areas, that we would have better systems. And instead of worrying too much about money, because what I've noticed when I was a manager, I always balanced my budget. And people said, how'd you do that? And I said, actually, I did the right thing. I didn't do any tricks. I didn't do anything fancy. I just actually looked at everything and I just did what made sense. And guess what? Balanced budget. It's easy. I think people think things are more difficult when actually they're quite easy. It just looks difficult. And so when nurses are really put to task, they can be very innovative, they can be very efficient, and they do really true care about the public safety, public health, and giving the best possible care for the community. So I think that's what's keeping me here. And that's what I'm working towards right now in Ontario, is that we get some recognition. And so that insurance companies and also the healthcare system pays nurses for the work that they do outside of a hospital, outside of an organization, that they can do it independently. There's absolutely no reason why not. If a massage therapist can do it, if a reflexologist can do it, traditional Chinese medicine, even a registered psychotherapist can do it, but an RN psychotherapist cannot yet do the same thing. So I think we need to really step it up for nurses, because they have stepped up for many years. And now it's time for organizations, for government, for politicians and leaders to say, hey, these guys have been around for a long time. And they've been doing this and they've got this wealth of knowledge and experience, and they have a theoretical base that's strong, over 100 years strong, for heaven's sakes. And how many offshoots from nursing came out and they're working independently? Then why not nurses? And so that's my passion now.
That's such a great note to end on. Well, I mean, myself in independent practice, of course, it strikes a chord as being, something that's recognized, and for insurance to look at a registered nurse's care as something that they provide funding for. I was also thinking, as you were sharing about a nurse-run hospital, one of the best jobs I had was I worked in a clinic that was run exclusively by nurses. And it was sort of a private clinic. We had a board of directors, but it was the most well-oiled machine, because we all felt like we were choosing what was aligned with us, what we were passionate about, where we could really grow and really just flourish in our independent gifts and skills. And when people are given the opportunity to do that, things take off. When you're feeling like you're stuck in a box, you can't grow in there. But when you're given an opportunity to fully just unleash yourself, the magic that we created in that clinic for people was, and it still is just, it's an incredible place. I believe it is because not just that it was only nurses, because we did have social workers and we did have one physician that worked with us intermittently, but it was because we were allowed to, be independent. It was because we were allowed to to grow and to expand and to learn and to try new things and to be a part of the decisions and to be heard, for our voice, but our opinions and everything that we brought to the table. I think you're so spot on. And, I look around and I hear all the stories that I hear these days, and I'm sure you do as well.
It's broken. It's kind of breaking down. Yeah.
It's very broken. Yeah. And it's falling apart around us. And we have to be looking at what are we, but also, the people who are in positions to make these decisions have to be looking at what are we going to do? How are we going to make these changes? And I truly believe nurses are the answer. If they would just look to us, in the group we have on Facebook, the Surviving Nursing, there's over 900 nurses in there. And I've said before, I'm like, if we had all these 900 speak up and have their voice and their opinions and their, what they believe should be going on, we could change the system for the better. We could have every answer that we need. We don't need more studies.
No,
we
exactly.
know.
As you're saying this, I'm thinking, even other healthcare professionals, for example, physicians, social workers, physiotherapists, they appreciate when nurses are allowed to do this. They appreciate it because it makes their life easier, their job easier. When I worked in ICU and I used to get a patient ready to get up who had a spinal cord injury, and because it was a trauma unit, so we had a lot of them. And I remember the physiotherapist, she goes, "Oh God, Piroska, I love it. You've got, everything's ready. You know what you're doing." It made her life easier to do all the work that she needed to because I already prepped the patient. Do you know what I mean? That makes a world of a difference. I remember the patient was going for surgery, and I remember very clearly that there was an issue that they had to make sure that a certain surgery procedure got done before, and everything was moving very fast. And so I just really made sure that, guys, you need to do this first before you do this, because blah, blah, blah. And the family was like, "Wow, you're amazing. You're like on top of it." They called me Quicksilver because I was moving so fast. And I'm like, no, because I know that when things happen fast, everybody's doing their thing, but you have to ensure that certain things happen in a certain order. And I have so many stories like that, really. And not just myself, but other nurses who are like, really, we're on top of it, saying, no, we've got to do it this way, because they're the ones who are at the bedside 24/7. So they know what's going on. And I think that then makes life easier for everyone else to do their job better, instead of everybody trying to do everybody's job. That's craziness. When I was listening to your story about your clinic, I'm like, wow, that's amazing. Because when you let people out of the box and you actually say, "What do you think? How can we do this differently?" And I remember asking the questions to my staff, and I was a nurse manager, and they all looked at me like, "You're asking our opinion?" I said, "Well, you're doing it. So you're the one who does it every day. So how do you do this here? And how can you do it differently that you think would be better?" And they were like all surprised that they were even being asked to think about it. And they had ideas, and then they opened up. And the other thing is, when we do that, that actually messages them that you're valuable, I respect you, and you have something to give. That just makes people blossom, because when they feel valued and that they can contribute, then they blossom, because they're like, "Oh, well, let me think about something different." Unfortunately, the system isn't quite that way yet. And I think there's a bit of competition among people. So once that goes away and people just really realize, hey, if we collaborate, and that's why when I introduce myself, or when you look at my LinkedIn profile or anything, I talk about collaborative systems, because that's what this is. Because we're not here because of me or you or my neighbor or a director or a VP. We're there because of the client, because we're there for the patient, period. If it wasn't for that patient, we wouldn't be there. So if we lose our focus, that it's about that patient and everything else, you put your ego aside, your degrees, your experience, everything aside, what is the best thing for this patient right now as a team? We focus just on that, then we'll get the job done. The problem is everybody else wants to position themselves. Oh, I can do it better. You can do it, whatever, like just all that nonsense. If there's leadership, and when you are that leader that says, hey, let's everybody put our heads together. How can we do this better? How can we do this differently? Is there a different way of doing it? Or does this work? That's a true leader, not the one that barks orders or says, no, we're going to do this and you follow the policy and that's the end of that. But the one that asks good questions and allows others to blossom. And it's also about succession planning. Like, how do I get them to blossom and then put them into leadership positions? Because there are some really amazing nurses who could be in leadership positions and they never end up doing it because no one mentors them, suggests it to them, or allow them to blossom. And I think that's something that we need to work on so that it's not about clique or who you belong to or who likes you or who doesn't like you, but really, what do you do and how do you add to the organization or to the plan or to this project that is valuable, that is in the core of it is patient-centered, period.
Yeah.
And that's all it is.
Yeah. I mean, I couldn't agree with you more on all of that. I think one additional piece is eliminating the threat, because so many nurses have this underlying fear, right? Of if they say something, if they do something, or, if if it's a little bit outside of that box, then someone's going to write them up. They're going to get a black mark on their record. Maybe it's going to go to the college. Maybe they're going to be disciplined. Are they going to be fined? Are they going to be called upon because their charting wasn't good enough? There's so much fear in us that stifles that ability to blossom, right? So
yeah, absolutely. That's such an old way of thinking, right? Like, meaning when that kind of leadership sort of is imposed on nurses, it's really not growth minded at all. And it's hard to get that fear of, yes, I'm going to be reprimanded and I'll lose my job or I'll get, support or whatever, reported or whatever that may be. You're right. That fear and that threat, it's kind of like a cancer, right? So, I mean, I'm hoping that you're doing a great job in having these conversations about this. And I think the more we have these conversations, something comes out of those conversations. Awareness, I think.
Awareness and connection.
Yes, true.
If we can just, go back into the story piece of it where you're sharing the amount it connected with me, I guarantee that every single person listening will connect, because that is a heart story, right? And I believe there is profound healing to be found in sharing our stories and to hearing other people's stories, to have that, it returns us to that human connection that we have with our patients, but it brings it back to us too. I just really appreciate you for your time and your openness and your vulnerability, and just being willing to, to step up to the microphone today and to share all of your knowledge and all of your wisdom and all of your guidance and experience. It's just really, truly such an honor to have you here.
Thank you so much. I really enjoyed it. I feel like I know when we met on the page that we right away connected. And I think now that I'm talking to you, like, you're inspiring me actually that we do need to have these conversations. And I think nurses are scared to have these conversations. And I think this is a safe platform that we can have them. And so I really appreciate you inviting me and allowing me to share my story.
Thank you so much.
I personally want to thank you for taking your time to listen to this podcast. It is my truest honor to sit with these nurses and witness them tell parts of their story. We as human beings have a deep need to be seen and heard, and this is my way of helping nurses in particular find their voice. Please know that the opinions shared in this podcast are those of the individual sharing them and not a reflection of any employer or regulatory body. We are sharing our truth, and that may not always resonate with you, but I'm guessing if you're listening, that something has rung true for you in this podcast. Our stories offer healing and create connection, two things that we as nurses need as we navigate the jungle of a healthcare career. So thank you for being witness, and if you feel inclined to reach out to the guest on today's episode to offer validation and appreciation, you can always find their contact in the show notes, as well as other links to the offerings of Sandra Payne Wellness. If you'd like to be a part of the community, join our private Facebook group, Surviving Nursing, and if you'd like to share your story on the End the Silence podcast, be sure to reach out. When we can come out of the shadows and into our light, we can create the change that is needed. And when we do this work together, we are so much stronger. Thank you for listening.